Let's talk through the booster shots at this point. I guess it's safe to assume that the FDA very likely will sign off on the same group for the Moderna and Johnson & Johnson booster shots that they've already done for Pfizer, or is that a stretch?
No, it's safe to assume, and in fact, the way Moderna, just what Meg covered, the way Moderna kind of put forward their documents, I think you could even make a reasonable argument that it's very similar, so similar, in fact, to Pfizer's, that an advisory committee might not be necessary. But I realize that in the interest of having this dialogue in the public, they're going to meet about Moderna, meet about Johnson & Johnson. We'll get that mix and match data. And hopefully, back soon after, the CDC will meet and we'll get some clarity, because I think Americans are pretty confused and also wondering. I mean, many of my patients and people are wondering, like, are we left, kind of exposed because we had Moderna or Johnson & Johnson in the first doses?
How much demand is there for booster shots at this point?
It's pretty high. We're outpacing booster shots we're outpacing initial doses by a factor of about 2 to 3 to 1. So we're definitely seeing higher demand. Not surprising. It's kind of reminiscent of those early days when over 65 qualified in a priority group, and we saw people flooding, websites and pharmacies and clinics. But having said that, we still have many supplies and doses on shelves. So we're not scrapping and trying to figure out where to get doses. And we're also bracing, hopefully soon, for pediatric doses in smaller trays to be available. So we'll be doing everything, Becky. Think about it. First doses, booster shots, a booster for Moderna of a different dose, and then pediatric doses in smaller sets.